Thank you very much. So I'll try to summarize 3 or 4 decades of research in 8 minutes. So I want to acknowledge the support that we've had from the Immunodeficiency Foundation of New Zealand, which is the patient support group, and Auckland Hospital as well as Lab Plus. We've had a lot of support from management. So I was born in Sri Lanka. We spent some time in the UK when my parents were doing their postgrad studies. And then my last school was Trinity College in Kandy. And as you can see, it was right next to a jungle. The biggest hazard we had as boys were the monkeys. And they used to hang out in the trees and swoop down and eat our lunches. So we had to keep our wits about us as kids. So the other thing also to say is that no consent was needed from this monkey because it was generated by AI. So the Royal Society can rest assured Peter will not sue you. So at the age of 12, my father got a job in Kew Hospital in Invercargill as a neuroradiologist. And of course, I was really excited because, as people know, these are some of the amazing New Zealanders who were alive at that time. On the left is Charles Upham, the only combat soldier to win 2 VCs, which will probably never happen again. And on the right, of course, is of Sir Edmund Hillary. So it was a big shock coming from the tropics to Invercargill. But this was mitigated by the warmth of the people of Southland, and I still have really good friends from my days in Southland Boys. What I also discovered was that the people of this country had a very strange religion called rugby. And whenever the All Blacks lost to the Wallabies or the Springboks in the old days, it wasn't just a matter of life and death. It was far more important, to use an old cliche. So coming back to slightly more serious things, so since I came back from Hopkins, I've been very interested in a condition called common variable immunodeficiency, which essentially is a black box where your immune system stops making antibodies, and therefore you end up having problems with recurrent infections as well as an overactive immune system. And one of the highlights I will talk about is epistasis, which is an interaction between 2 genetic loci, which was initially postulated in 1909, but we were fortunate enough to prove it with one of our families in New Zealand. So when you have immunodeficiency, it is really important to try and identify the genetic basis, if it is possible. And this is because there are specific treatments available. And if you identify these patients early, you can prevent complications, particularly chronic lung damage. And it also is important because these patients have long-term ill health, and therefore this can affect their marriage, work, school, etc. And of course, it has profound implications for family members who may be carrying this. So this is the summary slide of my PhD studies, where I looked at a family from Auckland that had a rare immunodeficiency. And as you can see here, H1 is the proband, the male, and he basically lacks the normal gene. So if I can use my pointer there. Whereas his mother, H3, has both the normal gene as well as the abnormal one, so she was a carrier. And the nice thing about this study was that we could reassure patient H2, who was the sister, that her children would not be at risk of having this particular condition. So I was fortunate enough to get a fellowship, a pediatric immunology fellowship to Johns Hopkins. And Clinton's America was an amazing place. And I had a great time there. And my main project was to identify the genetic defect in a colony of dogs that had complement component 3 deficiency. And after months and months of work, it turned out that they had a single base deletion, which produced a nonsense mutation of that C3 gene, and therefore they couldn't produce this protein, and they were susceptible to both immunodeficiency as well as autoimmunity. So this is the old days of sequencing, and we used to use radioactive P32, and so far I haven't developed myeloma. So coming back to my main interest in the last decade and a half, this particular condition. So there is basically a defect of antibody production as well as what are called T cells, which are very important as manifest in HIV, where patients don't have good T cell function. And what we were interested in is, could we identify the genetic basis of this particular condition, because very little was known about it. So carry on. One of the problems that we found was that there were no good criteria for identifying this condition. It was really a diagnosis of exclusion. So after considerable thought, we came up with this particular set of criteria, which are very helpful because they can be applied to patients across the world, and it basically produced consistent results in terms of diagnosis. So it separated out who would have the immunodeficiency compared with those who weren't. So in the next slide, what we also found was that people are continuing to have a long lag between the time they develop symptoms to the point that they actually are diagnosed. And you can see that on the bottom scale is the year of diagnosis, and you can also see that there are a lot of patients who are not diagnosed for a very long time. So unfortunately, the early diagnosis is not occurring as quickly as it should. And the other important finding from our studies was that unfortunately my Maori patients have a really bad form of this form of immunodeficiency, which was a real surprise because around the world this has been basically a problem of Europeans rather than other individuals of other ancestries. And what we did find was that Maori developed this very early, and unfortunately there is also quite a long lag between the time that they're found. So one of the most important things that we have found in this study and advise people to do is to check the antibody levels in Maori children, particularly those that have a chronic cough, because they may be suffering from this condition. And if they're picked up early, you can prevent long-term lung damage. So perhaps one of the luckiest things we found was epistasis, which is the non-linear synergistic interaction between two genetic loci, and as a novel mechanism of causing these immunodeficiencies. Back about a decade and a half ago, there was a new form of gene sequencing which came into existence, which was called massively parallel or next generation sequencing. And what happens here is that you can sequence pretty much all of the genes in the human body in one go, rather than doing one individually as we used to do in the past. So this is the family, the index family, where we found the interaction between the two genes. And what happened was one of my former PhD students, Vika Koopmans, had studied this family. And what she found was that the gene seen in the orange did not segregate with the affected patients. And in collaboration with the Walter and Eliza Institute, we showed that the individual that had both genes in fact had a worse prognosis both clinically and in terms of producing the antibodies. And it turns out that the two stars here affect the same pathway, giving you a much worse prognosis. So I'll finish off by thanking my family, my long-suffering wife Shanti up here, and my daughter and her family, my sisters and their families, as well as my parents who took a big risk coming to New Zealand. And my greatest teachers are my patients, and I thank them for enrolling in these studies for the benefit of others. And thanks to our grant support.